Okay, here we are. How's it going, everyone? Basically, today we are going to be speaking about Sigmund Freud, and the term that goes along with that is psychoanalysis. I'm Jacob, and this is Robert, and here we go.
Psychoanalysis was founded by Sigmund Freud, well, basically throughout his life and his work.
hmm Freud believed that people could be cured by making conscious their unconscious thoughts and motivations, thus gaining insight.
The aim of psychoanalysis therapy is to release repressed emotions and experiences, thus making the unconscious conscious.
Yeah. He used psychoanalysis as clinical methods for treating psychopathology, which is the scientific study of mental disorders.
Alright.
Next slide.
Psychoanalysis is commonly used to treat depression and anxiety disorders.
Psychoanalysis is a therapy as well as a theory.
In psychoanalysis therapy, Freud would have a patient lie on a couch to relax, and he would sit behind him and take notes while they told him about their dreams and childhood memories.
Psychoanalysts use various techniques as encouragement for the client, such as ink blots, Freudian slips, and free associations.
Alright, ink blots. The first method was known as Rorschach ink blots or projective test as the patient projects information from the unconscious mind to interrupt the ink blot. Different people will see different things depending on what unconscious connections they make.
Okay, awesome. So basically, this picture right here, I want everyone to take a look at it, take a snap, whatever your immediate thought is, and then hold it in your mind. So basically, in the picture above, if the first thing that popped in your head was a bat or a butterfly, it means you're normal. It's a common answer. But if you saw an animal face or a jack-o'-lantern, you should be paranoid, because that's kind of weird. But if you immediately thought of anything insulting about the female figure, you should be worried, because that's, I don't know, I guess that's bad.
Right. Why was this significant? Because ink blots are a common thing in therapy. It's basically the first thing every therapist does. And because most patients are reluctant and are unable to describe the thought process, this was a good way having a general understanding of how one's personality, characteristics, and emotional state.
The Freudian slip. This was another method of psychoanalysis. So it was an interesting form. Basically, Freud believed that if someone accidentally said a word different than they meant, then it actually wasn't an accident.
An example of the Freudian slip is when you're in a relationship with a girl and you accidentally call them by the ex-girlfriend's name instead of her name. Freud would believe you unconsciously liked the previous girlfriend more than your current, and wasn't accident at all.
Yeah, basically, he believed that there weren't any mistakes, that every action had a purpose and fate. Yeah. So the Freudian slip, this was important because it shows the unconscious wish of someone's trained for thought. This helps the person treating you because they have a better understanding of how you think.
All right. Free association. Lastly, another method of the psychoanalysis is free association, where a therapist will read a list of words such as mother, child, banana, cookie, whatever,
Yeah.
etc. And the patient is supposed to respond with the first thing that comes to mind. This was important for therapists to learn from the patient's immediate reactions to words, hoping to find out hidden repressions the patient might have, even the patient didn't know existed.
Cool. Yeah. And why is it important? Well, basically, psychoanalysis was significant because it seeks to explain the complex relationship between the body and the mind. It furthers the understanding of the role of emotions in medical illness and health, and because of this, psychoanalysis was the basis of other approaches to therapy.
Lastly, there are many examples of how psychoanalytic treatment has formed the basis for other treatment programs, such as in child psychiatry, family therapy, general psychiatric practice.
All right, awesome. That's pretty much it.
Yeah.
Cool.
Worksite page.
Boom.
Out.